acknowledging the traditional owners of the land we meet on today. So for myself, I'm on Wiradjuri country, which is down on the border of New South Wales and Victoria. But meeting virtually like this, we're all in different places, I suppose. And the one thing we do have in common is the land we're on always has been and always will be Aboriginal land. So I'd like to pay my respect to elders past and present, and to welcome any First Nations people to the forum today. So a little bit of an introduction about myself for those of you who don't know me. My name's Amy. I'm in the very strange netherworld between graduating medical school and starting clinical practice. So I'm not a doctor, but I'm not a doctor. As of next year, I will be Dr. Coops, and I'm starting my clinical work with the Victorian Rural Generalist Program down here. So I'm really excited to start my clinical work and to bring my passion for LGBTQIA health into the clinical space, and particularly into rural health. I think it's, really important to have visibility and representation, and I'm really passionate about, the intersection of those worlds. Just to move on to this evening, so I'll start obviously with a content warning. We are looking at LBQ women's health, and so there will be some topics and findings that you might find confronting or might bring things up for you. And if that's the case, we encourage you just to take care of yourself. And if that means muting or walking away from the computer for a while, that's completely fine. Do whatever you need to do. The email that you received with the forum link also has some places you can go if you'd like support after these forums, and please do reach out if you do need. Just in terms of housekeeping, if you have a question for the researchers, we'll save all of those to the end. So how that's going to work is down the bottom of your screen, there's the chat function, which obviously lots of you have found, so that's great to just have discussion. But if you have a question, please pop it in the Q&A box so we can specifically see we're taking the questions from there. But yeah, keep the chat going in the chat window, and if you're on Twitter, Viv and others, please do tweet away using the hashtag SWASH. And just a reminder that this session is being recorded. So to introduce our researchers, first, Julie Mooney-Summers is an Associate Professor at Sydney Health Ethics at the University of Sydney, and her research focuses on the health of sexually and gender diverse people, primarily related to tobacco, alcohol and other substance use. And we'll also be joined by Rachel Deakin, who's a Research Associate with South Eastern Sydney Local Health District and the Faculty of Medicine and Health at the University of Sydney. She's an experienced clinical researcher in the drug and alcohol field and with other vulnerable populations. In collaboration with ACON, Julie and Rachel lead the longest running periodic survey of lesbian, bisexual and queer women's health in the world, the very famous SWASH, which we will now hear about from Julie and Rachel. Take it away.
Thanks, Amy. So Dr. Rachel is going to manage the PowerPoint, and I will start with the first few slides. I guess to start with, also like to acknowledge the Gadigal people of the Eora Nation, who are the traditional owners of the land that I'm working on and that Rachel is working on, and that SWASH has really been deeply grounded for very many years. And not just traditional owners, but also traditional knowledge keepers. I think it's really important to acknowledge that Aboriginal and Torres Strait Islander people have been part of the survey for throughout its lifetime. So, as Amy mentioned, SWASH is a collaboration between ACON and a bunch of researchers. Rachel and I have been lucky enough to be those researchers since 2009, which is quite a long relationship. And I think SWASH, because it's either the only or the longest running, but probably both only and longest running survey of its kind in the world, we actually know more about LBQ women in Sydney than we probably know about LBQ women anywhere else in the world, which is really saying something. SWASH captures a whole range of different things about health and well-being, and it's changed over its lifetime. And here's a list on the screen of all the various things that it can capture. In 2020, we always add a few questions and tweak some questions. So in 2020, we also added some questions about people's experiences of healthcare and whether they felt like staff had respected their sexuality and gender. some questions about the desire to quit smoking or the desire to reduce alcohol or drug use. We also made some really major some really major changes around the way we ask questions about gender in relation to sex practices and relationships, and Rachel will touch on that a little bit in a minute. So as you can see, there's lots of things we can tell you about SWASH, and the way that we've decided to carve up the sessions with ACON is this one is we're going to really concentrate on demographics. So that's supposed to tell you a little bit about the sample, but actually also to tell you what we know about LBQ women and some non-binary people in Sydney. We're also going to talk a little bit about tobacco, alcohol, and illicit drug use, and then really look at all of the mental health data that we have, because we think that's really important. In terms of how we go about generating SWASH data, one of the really powerful things about SWASH is that we've pretty much been doing it in exactly the same way since 1996. Now, that might sound like we're afraid to innovate and change, but actually it's the opposite. It's knowing that if we are asking questions in the same way and we're collecting data in the same way and we're going to the same events to capture people, that any changes that we find are likely to reflect changes in the population and not things that we are doing differently, and that's why we've got different numbers. So it's really powerful to be collecting the data, mostly through paper surveys. So we have recruiters, peer recruiters, you see some photographs here, go out at Mardi Gras events, people and invite them to do the survey. And that's where most of the data, so about 90% of the data comes from for SWASH. SWASH has always been a survey which is aimed at women. So all women, cis and transgender women have been participating in the survey since the very beginning. It's for non-heterosexual women, so we exclude people who identify as men and we exclude people who identify as heterosexual. But apart from that, our recruitment is very open. We also do some online recruitment. So after we close the face-to-face, so once Mardi Gras finishes, so the season in February, which is when we collect most of the data, we then have an online option for people, and most of the people who actually do it online live in Sydney. So we're not actually capturing people outside Sydney. We're capturing people who, for one reason or another, couldn't get to a Mardi Gras event where we were collecting data, or couldn't stay to fill in the survey but really wanted to. I think there's an important question here about COVID that we just wanted to briefly talk about. So we collected paper surveys in February and we collected online surveys in March. We really think that the paper surveys were collected before there was really any impact from COVID. People were just even starting to talk about the fact that there might be something going on globally. The online data is a little bit different. Clearly, March was when things started to lock down and when changes started to happen in terms of particularly travel and movement, and venues started to close. But most of our online surveys were collected in the first week of March, and so we're pretty confident that the data that we have is as close to pre-COVID as it's possible to get. Having said that, it's important to remember there was a pretty horrendous bushfire season followed by a pretty horrendous flood season that happened just before that. So we are capturing some of the impact of that, I'm sure. All right, I might hand over to you, Rachel.
Thanks, Julie. So I'm going to start with going through some of the basic demographic data that we have about the participants in SWASH. So first of all, looking at the number of participants and number of participants in different age groups. In 2020, we had our largest number of participants ever. We got 1,588 surveys that we've included, which is we were really thrilled by that. So you can see the orange bars in the chart on the screen. Most of them are higher for 2020. All the bars peak in the 25 to 34-year-old age group. Excuse me. This is the age group that's generally most represented in how we collect data. And then going on to other information. So we find that women and non-binary people who are completing the survey are generally quite highly educated, employed or studying, or both. Unemployment is relatively low. Income, fairly high there. About 50% of people have dependent children. And the sort of cultural mix that we see, we get about 2/3 of people who are Anglo-Australian, and then smaller proportions of people who are European, Asian, or from the Americas or Africa and so forth. Aboriginal and Torres Strait Islander people were 4% of the sample in 2020, so that's around 70 people. Intersex people make up about 1% of the sample. And where people are, we've spoken about this being a Sydney cohort, and it is primarily about 15% of people don't live in Sydney, and most of those are from other parts of New South Wales, and it's concentrated in the sort of broader inner west region of Sydney and the city itself. Then looking at sexuality and gender, a couple of iterations ago, we changed the way we asked gender to the two-step question process that ACON advocates, which is asking people about their gender identity now, and then their gender assigned at birth or presumed at birth. So having a look at gender in 2020, a majority of the people answering were female. They were assigned a female at birth, so cisgender women. And then smaller proportions of people were women who were assigned male at birth. Some of these women may identify as trans or trans women. Large proportion non-binary people assigned female at birth. And then a smaller proportion non-binary assigned male at birth. Other identities or multiple identities, and again a smaller proportion with other or multi-assigned male at birth. Not reported was really small, under 1%. So even though there's two questions here rather than one, we're getting really good data capture. Then having a look at sexuality, so we asked people if they identify as lesbian or gay, bisexual, queer, or another identity, and there's also a field where people can write in another identity. Over the years, we've queer was included as a category in the mid-2000s, because in that other category we were noticing a higher and higher proportion of people were identifying as queer. So that's some of the small changes we've made to the survey over time. You can also see change in how people are identifying over time. The orange bars you can see sort of marching down over the years. So people who are identifying as lesbian or gay, especially in the younger cohorts, is decreasing over time. Yet other basic demographics are staying roughly the same. So we're seeing this as a shift in how people describe themselves and who they affiliate with over time. So amongst the youngest people, bisexuality or bisexual identity is the almost equal first category, and in a smaller proportion identifying as queer. Then on to sexual partners and practice. This was one area of the survey that we did a big overhaul on between the 2018 iteration and 2020. We had been aware for some years that our questions were increasingly not marching with the times. They were very binarized, very male or female, and didn't sit well with us. And we always had comments about it, of course. So we did sort of big sit down and thinking about this. And so now, instead of asking when did you last have sex with a woman, we ask when did you last have sex with, and we offer a range of gender categories, so for people to indicate who they've had sex with in the last 6 months, or ever, or never. So on this graph here we show who people have had sex with. The red bars are in the last 6 months, and the left-hand column is people who've had sex with a woman, a cisgender woman, assigned female at birth. And then we've got trans women, cis men, trans men, non-binary assigned female at birth people, and non-binary people assigned male at birth. So yes, the red bars indicate people have had sex the last 6 months. Yellow is they have, but over 6 months ago, and orange is never. Now, we did this big overhaul of questions, and one puzzle that we saw was that the number of people who, by how they answered the questions, indicated they'd had no sex with anyone at all, increased amazingly to 17%. Compared to 5% in 2018. Given there was no big change in demographics or sampling methods, we didn't really believe this. So we talked to the peer recruiters, we did some thinking and drilling down on the data, and the most likely explanation that we can come up with for this is that I think the change in terminology threw some people off, confused some people. Peer recruiters said they had some people asking questions about, well, what does cisgender mean? What do you mean by cisgender woman? We did have definitions on the survey, but unfortunately we didn't put them next to the questions where it really mattered. And so this is a bit of a lesson learnt for us. The proportions, people having sex last 6 months, are an underrepresentation or an underestimate of what has actually happened, what people have actually been doing. But still, this is some really nuanced data that we've just got for the first time here. We asked people about sexual practices, who they've, what they've done in the last 6 months. And so we've, instead of having it focused on what people have done sexually with women, it's what people have done with anyone who they've had sex with. So we've gotten much better data here. We'll note too that one of the little red flags we had from this was that more people reported doing sexual practices than had reported having sex at all. So that was one of our other, we think there's a problem with the question rather than with the data there. Then moving on, smoking it's one of our good news stories. There's some not so great stories that we have to tell here, but this is definitely a good one. Smoking rates have really dropped down in the last couple of years. It was at about over 30% and even higher in 2016 and earlier, and that's now below 20%, it's about 19%. This is still significantly higher than the general population. Data indicates about 13% of New South Wales smoke, and we're about at 19%. But the reduction is really pleasing to see. The big drop in 2018 we found hard to believe at first, such a massive change in a community in just 2 years, but that has been sustained through 2020, so we're actually believing it now. And particularly amongst ages 16 to 24, back in 2016, 40%, so we found 40% of young women were still taking up smoking in the LGBT community in Sydney. But that has also really dropped, not as low as all ages, but now it's just above 20% of the youngest women reporting that they're smoking. We asked a question about whether people would like to quit or reduce smoking, and 2/3 of current smokers would like to quit or reduce. So there's a big sort of need for help to quit and reduce out there in the community. 2020, for the first time, we asked some questions about e-cigarettes, whether people use them, how often they use them, and we found that although significant proportion had used or tried. Mostly this was just as a one-off or just a taste. Only 2% were regular users. And most of those were current smokers, or a smaller proportion were ex-smokers where they'd perhaps used e-cigarettes as a way to quit smoking. Then having a look at alcohol use, there's been really no change in time in alcohol use in our population. Having a look at the frequency by age group compared to the quantity drank by age group, you can see that people aged, younger people, particularly those aged 16 to 24 years, tend to drink less often. You can see the peak there at less than weekly, but then the quantity they drink is a bit more than older drinkers. Whereas those aged 45 plus years, there's higher proportions of drinking more frequently, but less likely to drink larger quantities of alcohol. So we also asked about binge drinking, people drinking 4 or more drinks at one session, and we found about 16% of women and non-binary people in our sample are drinking at those levels. But there's little variation on the age there. Okay, then next in the trifecta, alcohol, smoking and drug use. Illicit drug use. We ask about use in the last 6 months. We've noticed some increases amongst a number of categories of drugs here. There we go. From cannabis use to cocaine use also increasing. In fact, cocaine is now the second most common illicit drug used in this sample, just pushing ecstasy out of the second place there. Ecstasy's also increased a bit. Amphetamines is the only category where there has been a reduction. It's probably been taken over by ecstasy and cocaine use. And less commonly used substances, amyl, LSD and ketamine, have all had increases. I looked up some data on drug supply and use in general in Sydney and in New South Wales, and there has been increases in these categories of drug use across the board, particularly cocaine. There's more available in Sydney over the last few years. So we're seeing these proportions as really reflective of the general population around here. Okay, I'm going to just swap over to Julie now.
Thanks, Rachel. So we are going to spend a little bit of time talking about mental health. A reminder of Amy's trigger warning. I'll give you another trigger warning for the next slide, which I think is a bit more distressing, but it's important to say. Rachel and I present this data and talk about this data regularly, and we find this is the most upsetting data to present. So we've got several questions. We're going to report on them all. We're going to also report particularly on young people, because we think there's a particular issue there that's important to notice. So the first question we're going to talk about is something called the K6. So the K6 is a particular standardized measure that asks 6 questions, things like how nervous you felt, how hopeless you felt, how restless you felt in the previous 4 weeks. So it's very much capturing acute distress recent over those 4 weeks. We've been using the K6 for a long time. So here is a beautiful graph, nicely color coded. So green is good and red is bad. So if you look at the extreme right hand side, those bars are 2020, and so you can see that we're there's not a lot of green, and there's quite a bit of red, which is very high distress, and the orange bars are high distress. So the things to notice here is overall in the sample, about 45% reported high or very high distress. Among young people, so that's 16 to 24, 66% were categorized as experiencing high and very high distress. So 66% is a pretty substantial proportion of young people in the sample. We've had a look at data from New South Wales, and this is looking at women in the general population in New South Wales. And I think that's 28%. So that's 28% of young women in New South Wales in general, compared to 66% of young LBQ women and some non-binary people. So that's a pretty stark difference. The other thing to notice, if you look back over 2018 and 2016 data there, there's not a huge difference. So kind of similar-ish amounts of red and green, maybe a little bit of a decrease in green among the older age groups. If we went back on, looked at 10 years worth of data, you would see a difference. So we've been seeing distress rising really since about 10 or 12 years ago. And it looks like kind of when it hit 2016, 2018, things have kind of leveled out. I don't know whether we've hit a ceiling of distress, but certainly it looks like that's a substantial proportion who are experiencing that distress. Next slide, please, Rachel. So before we, again, this is a trigger warning, so we're going to talk about suicidal ideation and self-harm. You might want to turn me off or step away until I flick through to the next slide. So we asked two questions here, and we've borrowed these questions from a longitudinal study of women's health in Australia. So we wanted to make sure that we had good questions. And we introduced these questions in 2018. So the first question is, have you ever felt life was not worth living? And the second question was, have you ever deliberately hurt yourself or done anything that you knew might have harmed or even killed you? So if we have a look at that data, the first thing we to say is 30% of the sample overall said that they had felt that life was not worth living over the past 12 months. So if you look at those red bars, that's looking at those age breakdowns. So the most striking thing here is that the relationship between those feelings and age. So among young women and non-binary people in the sample, 42% said that they had felt that life was not worth living in the last 12 months. And in fact, if we look at ever, that's 71%. So that's pretty striking that the majority experiences to have felt those feelings around the worth of life at some point. If we look at the orange bars, they're about self-harm. So that's 12% over the last 12 months in terms of the whole population. And again, we can see that relationship to age. So among the youngest participants, 25% of young people said that they had deliberately hurt themselves or done something that they knew might harm them or even kill them. Again, if we look at ever, that rises to 62%. So again, a majority experience in terms of the proportion who'd ever self-harmed. And that's incredibly striking data. And we've not really seen a change from 2018, so that's pretty consistent. I think one of the things to notice here is that the majority of people reporting that they have had that feeling that life wasn't worth living or who self-harmed also were reporting acute distress. So I think that's important just to notice that this is not something in the distant past. This is, even though we don't know when those feelings were happening, but certainly most of these people are still experiencing high distress. And again, it's important to remember they were experiencing that distress in a setting like Fair Day or another community event or a bar surrounded by friends and family. And that's when they were telling us about these things. Next slide, please, Rachel. So the last slide on mental health that we want to talk about is about service access, because we think that this is actually a really good news story. So 71% of the sample had said that they had accessed counselling or psychological support services in the last 5 years. And if we look just at young people, that's 75%. And actually, we don't see much of an age relationship here. So it's still 75% when we look at the people in their 30s. When we look at the older age groups, it only goes down to 61%. So the good thing here is that it demonstrates that LBQ women and some non-binary people know that they are needing support and that they are accessing support. And I think that that's a really really good thing. What we don't know is very much about what support they're accessing. So we don't know if they're accessing LGBTQI services. And Rachel, if you flick to the next one, they'll pop up. So these two services in particular, we just want to point people towards. So we don't know what type of services they're accessing. We don't know if they're crisis services or long-term support. We really don't know whether they felt safe in terms of sexuality and gender in those services, and whether they were effective in terms of providing the support that they needed. That's not something that SWASH can do, but it really points to a need for some more research on that kind of work. Okay, next slide, please. So the last slide, and we wanted to end with this, and I think that's because if we think about what are the kinds of things that we think might be causing that kind of distress that we're seeing, we think about people's experiences of family rejection, of societal rejection, of experiences of harassment and abuse, which we think contribute to the higher alcohol, smoking and drug use that we see, and also in terms of mental health. But we also think often of community connection as offering a kind of buffer against those things, as moderating it, or maybe even an antidote to those experiences, because it offers people support and acceptance. So perhaps unsurprising among this group of people who we mostly got through Mardi Gras events, that most people felt very or mostly connected to LGBTIQ community, that 45% said that most or all of their friends were LGBTIQ. Most people, so 75%, said that they had attended an event recently, an LGBTIQ event. I think what's interesting in terms of this data is the sense of connection hasn't changed over the time that we've been doing this project, but what has changed is the way that people are engaging with community. So we've seen a real drop in the proportion reporting that they're attending those different kinds of community events, particularly lesbian and queer women's nights, but also actually the opportunities to attend those things has changed quite dramatically. We saw a bit of an increase around community events and group meetings around marriage equality, as you might expect, but on the whole, we've just seen a decrease in those things. The other good thing I think to kind of see about this as a highly engaged and community connected group, it also means that organizations like ACON have the possibility to engage directly in terms of being able to provide access to services or to engage around health promotion, and that's clearly a good thing. Next slide. So we just wanted to end with a slide just to kind of bring you back to the beginning in terms of why SWASH matters. So we know that there's lots of international evidence showing poorer health outcomes for LBQ women, and to a lesser extent non-binary people, and that's just about a lack of data. And SWASH, so in that context, SWASH provides the local evidence to kind of say, well, actually, it's not just LBQ women in America, it's also LBQ women here, so we can demonstrate what the health outcomes look like, and they can inform policy and best practice. And we already know that things like the National Women's Health Policy are using SWASH, and the New South Wales government will be producing an LGBTI health strategy early next year, and SWASH again is providing evidence for that. And of course, as the kind of driving partner in this project, ACON absolutely uses the data to develop services and health promotion activities, often using it in terms of advocating to governments, to healthcare systems in terms of providing better access and the right kinds of health. Even just saying, no, smoking actually is really an important issue for LBQ women. And of course, ACON advocates to mainstream organisations who are providing health services to our community. So I think it's really important to recognise the way in which this project, which is absolutely community doing it for itself, this is not a funded project, is producing the data which can then be used to advocate for the kinds of services that we need. So even whilst it can be confronting, and it's absolutely confronting to see some of those data, being able to make it visible allows us to be able to then advocate to healthcare providers and say, actually, I think you need to pay special attention to LBQ women and non-binary people. So you can access the full SWASH report. It's just gone on the ACON website, and you can read about it in all of the detail. If you want to know about Healthcare Access and Experiences. That's the next forum. So that's the same time next Wednesday. We're going to talk about that data. And there'll also be a panel of people to talk about those issues and respond to them. And then the following one will be about alcohol and drug use. And again, there'll be a panel of people to contextualize some of those findings and talk about what we might do about it. Thanks. Back to you, Amy.
Fantastic. Thanks so much, Julie and Rachel, for taking us through the data. We've got a heap of questions come through with the registrations, which I'll fire some at you now, and then we've had a few come in the chat as well. So I'll start with some of the questions that have come in with the registration that people would like to have answered. So firstly, someone's written in to say that 4% of the SWASH sample self-identified as Aboriginal and or Torres Strait Islander, and you alluded to that as well when you were speaking. Are those numbers too small for any analysis, and does SWASH have plans to use or highlight some of this data relating to Aboriginal and Torres Strait Islander LBQ women, whether these be trans or cis?
Yes, is the short answer. We would be really interested in partnering with Indigenous researchers to interrogate this data more strongly. I think I said earlier, the 4% level is about 70 people. We can do some things with those data. There's also various techniques for merging data from different years, and we would love to work with people about that to interrogate the data in a culturally appropriate manner and to get Indigenous researchers to talk about that data.
You may not know the answer, but just to follow up, is this sort of reflective, this 4% in the survey return, is that reflective of like population prevalence? So is that less or more?
In New South, or in Sydney, it is about, yeah, it's about the right.
Okay, so it is representative in that sense.
Yeah. We've had higher numbers in the past, but so usually we're overrepresented, but yeah.
Okay, excellent. So another question that's come in, why don't we use SWASH to indicate health outcomes for non-binary people?
Awesome question, and I hope you notice that we're being very careful about talking about some non-binary people. So SWASH has always been a survey that's been aimed at women. It's often called the Women's Survey, and is often seen as the kind of sister project to the Gay Community Survey, which is the survey for gay men. When we changed the gender questions to allow people to indicate what their gender was, which is started in 2018, we were a little bit surprised to see such high proportions of non-binary people participating in the survey, given that it's been a survey for women. So in 2020, after we collected the data, we did some consultations. So we went and talked to some non-binary people who had filled in the survey and some people who hadn't, and asked them about what might be the motivations. Because one of the decisions we had to make was, do we keep the non-binary people in the survey, given that we're trying to say it's a survey about LBQ women? So we're very conscious that most of the non-binary people are people who are assigned female at birth, so it's not representative of non-binary people. And so we have to be very careful about how we describe the findings so that it's not suggesting that it's telling us about non-binary people. We've done no analysis, and we won't do any public analysis that says what the non-binary people in the survey said. We are very supportive of working with non-binary researchers and community members to make sure that there are other avenues to find out that data, because it's obviously really important. SWASH is limited in terms of how much it can do that.
All right, another question that's come in. So what does SWASH tell us about previously heterosexual women with children whose sexual attraction or identity changes? Can we see those people in the sample?
The short answer is no. We have no way of identifying those people in the sample at the moment. We don't ask a question about whether people's identities have changed. There is some research in Australia that shows that women's sexuality, so women's sexual identities are much more likely to change over time than men. So there's a good reason to ask about that. We haven't done it to date. We don't know, and I think we have to be really careful not to assume that that's not possibly a majority experience in the SWASH sample. So I think it would be it would be wrong to think that the SWASH sample is mostly people who came out at age 16. I think that we would find a great variety of those experiences.
Is it something to probe in future?
I think it would be interesting to think about how we would respectfully ask a question about that. Obviously, the SWASH questions are what's the word? Every question is incredibly valuable. So we try really hard to make sure that there's bang for buck. So we ask a question, it means we think someone's going to do something with it. So we work very closely with ACON to try and make sure that we're asking questions that will then feed into some kind of program development or advocacy work.
I might just pop into the chat for a question that seems sort of relevant to this discussion that we're having now. So from SJ, she said, or they've said, did you have any pushback from questions about gender assigned at birth? We've had some feedback that trans folks found it distressing on an application form we created. So I guess this comes to your comments. Yeah.
Well, when we made such a big change, we were concerned. Well, when we make changes, we're always concerned about how people are going to receive them, and we're concerned about, data quality and what people think of the survey. But we found that there was like that missing data that I highlighted in one of the first slides. There was only, out of 1,588 people this year, for example, there was only under 10 people who didn't complete both questions. Also, in the we do get feedback, and overwhelmingly it was positive feedback about having those questions. So I think we certainly don't want to upset or distress anybody by those questions. But I think being able to talk about who we're sampling and who's in the community is a really positive thing.
Has the study, so this is a question that's come from with the registrations, has the study identified any regional specific trends, in particular for people living in Greater Western Sydney?
So this is a very Sydney-centric survey. We've got about 15% of people who live outside Sydney. So in terms of a regional perspective, we haven't looked at the data in that way, and I would hesitate to, because I also doubt it would be representative of the regions. I would think a lot of people would come from close by, Newcastle, Wollongong and so forth. In terms of Western Sydney, which is a large geographical and population area, we do have larger numbers. I think the proportions are something like 20%, so a couple of hundred people people each iteration, which certainly we could do something with, and we'd be really interested to partner with someone who's interested in finding out more about how people not in the inner west are going, how they're going.
I'm going to put in the chat a link to the SWASH report from 2018, when we did a specific SWASH in the Northern Rivers and Mid-North Coast region of New South Wales. So I think that's a really valuable to kind of look at specifically a regional area that has quite a significant proportion of queer folks. And also to say that Mid-North Coast Primary Healthcare Network have also done an analysis of their own data in terms of sexuality, which they've then put together with SWASH data to produce some kind of, information papers for both the community, but also for healthcare workers in that area. So it's kind of, there's a surprising amount of data and information there. So I'll just pop that in the chat for people.
Great, thanks, Julie. There was a question that came in from Mel or Melly, sorry if I'm mispronouncing, about data on intersectional identity and the relation in particular to community connection. Is there anything in the data that's revealing on that question?
I guess what so the way SWASH, the way we tend to run SWASH is we produce the report, which is just descriptive. So we kind of the data that you've seen basically reports on the proportion of or the frequencies in relation to each of the questions. And the priority really is to get that data out so that, and we, it's also important to notice that we do that as a public report. It's not something that we do as a peer-reviewed journal article behind a paywall, so someone has to pay for it. So it's trying to get that data out as quickly as possible. Additional analysis, so looking at those kinds of questions around intersectionality or looking at the relationship between different health issues and identity or demographics, tends to come next and depends a little bit on Rachel and my capacity. Neither of us are employed to do this project. So we've done an analysis on pap smears as they were then. We've done an analysis on smoking. We've done an analysis on sexuality, specifically looking at different health outcomes and health practices. We'll be doing some analysis in the coming year on illicit drug use and following up some of our smoking data. So what we tend to do is it's a little bit driven by us, and it's also someone coming to us and saying, I really want to do this piece of analysis and you've got the data. And then we work with them to get that piece of work done. So come and talk to us and bring your time and your capacity, and we will work with you on that, because I think that those kinds of issues are really important.
Yeah, look, Julie, Kate Robertson said in the chat, she's loving the data collection and infographics and sounds like SWASH is improving every year. So how do we get more involved as individuals? Maybe you'd like to give Kate something to do.
Yeah, send us an email.
Yes.
Awesome. So onto the question of bisexual, it was interesting, you know, you've obviously highlighted this in your presentation. We're seeing increasing numbers of people, particularly in younger demographics, identifying this way. Someone's asked how many bisexual people are included in the SWASH sample. Is SWASH representative of the bisexual community if SWASH is recruited for in LGBTIQ+ events or spaces?
So I think it's really important to remember that SWASH is not representative of the Australian population, and we would never claim that it is. I think Rachel has reiterated a couple of times that it's very Sydney-centric, but it's also connection-centric. So SWASH was designed as a survey to understand the experiences and the health of people who are engaged with LGBTIQ communities. So that means that if people might identify as bisexual or lesbian or queer, but they don't engage with community, we're unlikely to find them because of the way that we generate the data. And that's a reflection of the history of SWASH, but it's also a reflection of the partnership in terms of the kind of the capacity of ACON to engage with those people. So it's definitely not representative of bisexual people. And I think the relationship that we see between bisexual identity and age, I'm not sure that reflects the general population. I wonder if there's something about as women partner up, and if they're in a relationship with a man, they might be less likely to come to LGBTIQ events. They might be going to bisexual events, and it's possible we're not getting those as part of the Mardi Gras season, which is when we do our data collection. So I think that it's important to kind of look at to understand what's the kind of scope of the claims that we can make about the SWASH sample, and recognize where the gaps and whose voices are missing. There are absolutely people missing.
So this question from Kathy in the chat sort of relates to that, I suppose. Is there a case to survey the Australian context in parallel with the Sydney studies, or is there already an entirety of Australia parallel study going on?
Kind of. So Private Lives is a national study that happens roughly every 5 years that does LGBTIQ people. It's a little Victoria-centric in terms of the proportions. I think that's being launched. I think Ruth McNair is here. Maybe you can remind us what the date is, but I think that's being launched pretty soon in the next month or so. So that will be really interesting to see what that looks like compared to what SWASH looks like. What I think SWASH is a bit different, partly because of the history over time that we've been collecting the data. We did a SWASH in Perth for several years. We've done a SWASH in the Illawarra region and obviously the Northern Rivers. The way that I think we're always open to doing it in other places, but it's always about money.
There's another question from Kathy that's actually a really good one. I'd be interested to know the answer to this. Have you ever measured the perception of folk in respect of community support? And it's given the example, i.e. family of choice versus natal family or natal family. I don't know if I'm saying that correctly, but I think you know what she means.
Mm. So we that sort of perceived support from people around you, whether it's family, chosen family, friends. We don't ask about that specifically, and we haven't in the past. We ask about community connection, which can mean different things to different people. And that's always been very strong. But specific questions about, especially differences between birth family or rearing family and family people have around them now, that would be really fascinating to have a look at. Actually, yeah.
Thank you to Miranda for putting up logical family or biological family. I like that. Maybe a better way to put it. And
Yes.
Ruth has just said, for those who aren't looking at the chat, Private Lives is a national sample and is being launched on the 13th of November via Zoom. So you can get the details from La Trobe Uni. Contact a.lyons@latrobe.edu.au. Back to the questions that came in with the registration. So someone's asked, this is a bit of a heavy one, as in like there's a lot in it, but what is the most prevalent health issue challenging the lesbian community? I guess we should probably say in terms of SWASH, the LBQ community. And they wanted to know, is this common to gay men's community? So do we have different challenges? And finally, the final part of the question is, are these challenges, however we identify, whether we're, gay, lesbian, men, women, something in between, none of the above, are these catalyzed by physical, mental health, or primarily by the soul?
I'll answer the easy part first, which is one of the fascinating things when you look at the history of research about gay men and about lesbian, bisexual, and queer women is that gay men's research has really been driven by HIV concerns. So we actually don't know very much about gay and bisexual men's health in general. We know much more, surprisingly, about LBQ women's health. So when we kind of look at what might be the different issues, it's actually quite hard to know because I think we don't have great comparable data. In terms of what's the issue, I mean, I think mental health as an outcome, but really to go to the first question, the last part of your question, I think the problem is societal discrimination, homophobia, biphobia, transphobia, sexism. I think those are the drivers of those issues. So I think it's really important to remember that our sexual identities and our gender identities aren't the health problem cause. They're not the risk factor here. And so when we're thinking about those health issues, they're indicative of a problem, but that's not what the cause of the problem is. So I don't think it's physical, mental, or soul. I think earlier I described it as those bastards, but it's those bastards who are discriminating against us.
Well, I'd like to know, in that vein, is there, what does SWASH actually tell us about, these drivers of health? Does it tell us anything like that? Does it tell us who the bastards are or what they're doing?
It doesn't tell us particularly who the bastards are, but it tells us what they're doing. So we do have some data on experiences of anti-LGBTIQ, so abuse and harassment. And I think one of the things to notice is over time, and this is one of the nice things we get from SWASH, that people's experiences of anti-LGBTIQ behavior was decreasing. We saw a big jump in 2016. Remember the marriage equality debate and the doors that were opened and the permission that was given? So we saw a big jump there, and that's continued. We also asked this year for the first time about people's experiences of online harassment, and that was the second highest. So I think that we can absolutely see that it's a very common experience that people are reporting that anti-LGBTIQ behavior.
I assume the survey doesn't tell you particularly why, but do you have any thoughts on why, the marriage equality data made sense, as in like we were in that permissive kind of environment? Why is that continuing? Do you have thoughts on that?
Well, I think marriage equality debate gave permission to people to voice things that in public that maybe they wouldn't have done before. And I think it's important to remember that marriage equality didn't happen, then everything else stopped. So we've got and Viv, you can tweet this, the loopy Mark Latham bill and the religious, I think all of those kind of ongoing, I don't think it's too dramatic to call them assaults on LGBTIQ people, have continued. So I think that and also there was other things happening apart from marriage equality. Safe schools was happening at around the same time. So there's quite a lot of that going on, and I don't think it's just stopped.
Look, I should have probably said, I should have known, I should say, like a content warning before asking you that question. But yeah, just to remind people that might have brought up something for them. And if they need support, please, reach out. And it's not been an easy few years for any of us, I don't imagine. That's the end of the questions that have come in the chat and in the registrations. And that's pretty well just in time. So I'd like to thank everyone for coming. It's been such a great conversation. I think we've all we've learned something, and you've certainly whetted people's appetites, it seems, for the next few forums. People saying they're looking for the next one. So, thank you so much, Julie and Rachel. This is, as I said, just the first of 3 forums. We'll be having another one, same time, same place next week. And that will be on a spotlight on healthcare and screening. Again, we will have Julie and Rachel, and we'll be joined by a few other special guest stars. So Karen Price from ACON, Dr. Viv McGregor from Checkout, who's very sad she won't be tweeting at that moment, and she'll be a hard act to follow, I'm sure, after tonight. And we'll also have Liz Duckchon from Trans Test. So Julie's, someone has indeed popped in the chat the link to the SWASH 2020 report. So we'd love it if you'd go and check it out. And continue tweeting, #SWASH, share amongst your friends and keep the conversation going. If you've registered to come to this forum, you'll also get the report emailed to you shortly, if not already been done. So please, keep the conversation going. And until we see you next time, take care and thanks so much.
Thanks, everyone. Thanks, Amy.
Thank you.